Yeah. So good evening to everybody, respected my teachers and other participants. This paper we are dedicating to our hypnosis guru, Dr. Palan sir and other teachers. Of course, Shruthi, she is in this organization for more than 8 years. She is basically a rehabilitation psychologist registered with the Rehabilitation Council of India. Actually, after she joined in this organization, actually our organization, we have two folds. One is training. We are giving a lot of training, workshop and short-term training for the young psychologists as well as the young, students, the budding students, budding counselors and so on. And this is number one. Number two is we are having a clinic where we see different types of children, those who are having neurological issues, neurological developmental issues. Of course, we are seeing the anxiety, depression, OCD, and so on. So now, actually, she is also one of the instrumental for joining for PGDCS course conducted by you, sir. Actually, I was keep on telling, I want to specialize in clinical hypnosis. Actually, she only found out all the details and immediately I have joined. I am very happy to say she is one of the assets for this organization, and she is conducting a lot of training program as well. And of course, she is giving psychotherapy, counseling for the clients, those who are in abroad, especially those who are in US, UK, Dubai, and so on. And of course, now she is pursuing her PhD, and her area of specialization is autism spectrum disorder. Very soon, before this year, she is going to submit her PhD thesis. I am her guide for her PhD work. So this is a brief introduction about all these things. Then actually, after I learned the clinical hypnosis, I motivated her to learn a lot of things. Even we have purchased some books, especially books, authored by our Rocket Jain sir and Hammond, and of course, actually all the study material we have referred in and out, day and night we used to refer, and we used to create a lot of research. So one of the research she has taken, of course, she is having some corporate clients also. She worked with the corporate clients, and actually the problem those who are having the corporate client mean it is a center called wellness clinic. That wellness clinic, she has found out there are some people, those who are suffering from chronic physical illness like cancer and lung problem and so on. So I told her to take up those sample and apply the clinical hypnosis in order to minimize their pains. So this is how this paper has been emerged. With your blessings, with the blessings of others, I invite the wonderful student, Dr. Shruthi, to give the presentation, sir. Shruthi, one thing you must, I am sorry for the interruption, they are all hypnotic giants. We are all infants. We are all infants, especially the hypnosis is concerned. The many questions probably they may pose, try to answer them. Of course, I have faith on you. Please do it. Please
we are all learners.
Yes.
We are learning from each other. So, Shruthi, I invite you. You can. I have made you co-host if you want to share your presentation.
Okay. Good evening, everyone. I take this opportunity to thank everybody who has given me this opportunity. I take this pleasure to thank Dr. Santanam sir once again for being my guide, for being there all the time for any endeavor that I'm doing and motivating me further and beyond in whatever I do. So a heartfelt note. Thank you very much for giving this opportunity and guiding me through this. So, like sir was telling, we tried to apply clinical hypnosis techniques for people who are in chronic pain. So initially, while we were working with a wellness center, there were a lot of. Are you all able to see my screen? So,
Yeah.
So, patients with chronic pain due to medical conditions like osteoarthritis, lung cancer, gallbladder issues, we tried to see if pain management through hypnotic techniques can be a important psychotherapeutic method in improving the person's quality of life. So that is how we emerged. Initially, we had taken around 60 different patients in each group, like arthritis or gallbladder issue and lung cancer. But due to a lot of dropouts in lung cancer, we lost a few patients. In gallbladder disease, some of them had to drop out because they could not come to the clinic. Some cases we, with the help of, under the supervision of Dr. Santhanam sir, in some cases we went to their houses and treated. So those cases we have not taken clinical consideration for this research. All the data that we are submitting here today, the 45 number that we are submitting today here as a part of the research, was done under the same clinical condition as a random sampling group. So people with chronic pain due to medical condition seem to have a lot of psychological distress. उनके जो मन related issues जो था वो बहुत physical health में contribute कर रहा था. So what we thought is other techniques like cognitive behavior therapy या जो systematic desensitization जो भी हम करते हैं उसमें बहुत सारे समय उनका कॉन्शियस माइंड का हम यूज करना चाहते हैं और मोस्ट ऑफ द टाइम्स विथ अ लॉट ऑफ पेन मेडिकेशंस it was little difficult for them to consciously apply it every single day. So when we tried to look at other psychotherapeutic methods with the guidance of Dr. Santhanam sir, we tried to see if pain management through hypnotic techniques is an option, is a viable option for us to introduce in the entire pain management system itself. So we have a very highly rational belief in modern medicine, which we try to challenge without a lot of rationality. We try to challenge the belief this time. Medical hypnosis involves careful planning and a number of medical conditions. We were able to find the research for a number of medical conditions today with hypnotic treatment. However, we wanted to try out certain specific scripts and certain specific techniques that could help us in this. So we tried to create an intervention module. Our objectives of the research was to create an intervention module for reducing pain, for reducing the psychological symptoms like depression, anxiety, stress, और उनके quality of life, वो 6 domains जो होते हैं quality of life में, उसे improve करना was our, to create a hypnotherapeutic intervention to do all this was one of our major objectives. And thereby we wanted to try and see if the pain is reduced and the psychological symptoms are reduced and उनके जो quality of life, physical domain, psychological domain, social domain और environmental domain में improve होता है या नहीं. So हमारे objectives when we started was to identify this. As per this, we tried to create our hypothesis. We created a null hypothesis where we assumed that there will not be any significant difference in the level of pain before and after the intervention. There will not be any significant difference in depression, anxiety, or stress before and after. And there will not be any significant difference in the quality of life before and after the hypnotherapeutic interventions. 45 patients, chronic pain due to osteoarthritis, lung cancer, active lung cancer in treatment, and gallbladder disease were selected using random sampling. We got consent. Some of them were not interested, so it was not possible for us to give hypnotherapeutic intervention for them. So in total, we were, like I said, we were able to get the consent of 62, of which 45 were done in this clinical setting. So all the 45 we are presenting in the case study. A pre and a post test design was used. So हमने intervention के पहले थोड़े बहुत tests और assessment करके उनके baseline measure कर रहे थे. उसके बाद therapy और उसके बाद we tried to do a post test of the same questionnaires for understanding how they have improved. So for this pain के लिए हमने McGill pain questionnaire by Melzack use किया. Depression, anxiety और stress ये तीनों के लिए हमने DAS questionnaire, DAS 21 Lowy Bond जो author है उनके questionnaire use कर रहे थे. और quality of life questionnaire by WHO, the brief version where 4 domains are quantified हमने use किए थे. The bigger version, which has 6 domains, is not quantifiable. So for us to quantify this data, we used a brief questionnaire. और हमारे जो सैंपल थे उसमें 40% का ऑस्टियोआर्थराइटिस ग्रुप था, लंग कैंसर में 26% और गॉल ब्लैडर डिसीज में 33% was a sample distribution. Between the age group of less than 40 was 26% of the population. 40 to 60 years, 48% of our population. Above 60 was 24% of our population. Gender distribution is what is shown in this slide here. So for our gender distribution, we had 57% of female sample and 42% of the sample was male. So the McGill pain questionnaire is one questionnaire which we try to use. In this, it includes 3 different sections. So the first section goes by what does your pain feel like? Throbbing pain hota hai ya dard dhimi gati mein it keeps increasing hota hai. So pain, what does it feel like? Kaisa lagta hai? How does it change over time? So it starts slow, becomes very severe over time, or it starts very severely, it continues to be the same, kam hota hai. So how does this pain change over time? And how strong is your pain in a rating scale is what this questionnaire measures in 3 sections. So since the questionnaire typically assesses the present level, so the current level of pain is assessed, the same has been used to maintain and monitor the pain over time. So it's not like over 4 days, how has the pain been? So abhi is samay mein kaisa lagta hai aapko? Or the same was measured for, actually we gave this pain questionnaire for every week, but for post-test we considered only the last, after the intervention, only we have taken for statistics, but we did have a quick feedback of how their pain is every session. The next one is the DAS questionnaire, consists of 21 questions. All these tools are standardized tools. So we had a 0 to 1, 0 to 3 on a rating scale, where 0 stood for doesn't apply to me. The statement doesn't apply to me at all. To 3, ये जो statement है ये बहुत ही most of the समय मुझे applicable होता है. So it various measures on the specific anxiety, state anxiety, measures the depression and the stress of the person over 1 week. So the last 1 week इसमें हम consider करते हैं. And we use the brief WHO quality of life questionnaire to understand their 4 domain analysis, we used the physical health, psychological health, social relationships, and their environment. All these 4 factors were measured using this questionnaire. Subsequently, after administering the above mentioned questionnaire, clinical hypnosis का जो तरीका है वो explain कर हुआ था, और consent, misconceptions जो है, myth जो है, many times when we spoke about this word hypnosis itself, patients were confused whether we are going to do some past life analysis with them, whether they will be going always in trance. So these kind of myths were all very common. So we tried to explain a few sets of myths and misconceptions to them. We tried to explain to them how a session of clinical hypnosis would go. And then we took a formal consent, informed consent signed from each one of them. So our पहले सेशन हमने इंडक्शन के लिए ब्रीदिंग अवेयरनेस, मस्कुलर रिलैक्सेशन, डीप एंड थ्रू द स्टेयरकेस टेक्निक कर रहे थे. We used Dr. Palansar's script for the same, and we tried to elicit their phenomena in terms of whether they are in the trance through hand rigidity, and we tried to terminate the session through some post-hypnotic suggestions. So this happened for the first session for all of them. It took around 18 to 20 minutes for most of them. Some of them went into trance quite easily. So we did have a great experience in eliciting the phenomenon here. Session 2 में हमने breathing awareness, progressive muscular relaxation, deepening through the staircase technique. We did the phenomenon elicitation again through hand rigidity test, and we started giving certain suggestions of ego strengthening before we did the post-hypnotic suggestions and termination with them. For this also we used Dr. Palansar's script that we had with us. So each session happened between a duration of 2 weeks. So first session, between the first session and the second session, we had 15 days. Totally, we had around 6 to 7 sessions. So in the third session, we used a control switch technique and body light technique as suggestion. This we took from the Hammond book. The authors were Ernst L. Rosie and David B. Cheek. So we used both of these scripts as suggestions, and we induced some post-hypnotic suggestions and termination. For the session 4, also we did a similar control switch technique and body light technique. Both of them are very particular in both these scripts, focused particularly on pain management. So we used both these scripts for the session 2 also, session 4 also. For the session 5, we used suggestions from depression, anxiety. This was given by Dr. Palansar and Dr. Rakesh Jain. Ka jo script hai, we created a script from these, and we gave post-hypnotic suggestions and termination. At this time, we started giving patients a self-hypnosis training also. Some patients requested for an self-hypnosis training audio. So we gave an audio version of the same for all of them. So this took around 25 to 28 minutes in most patients. So when we tried to do a analysis based on the post-test, so we have a mean and a standard deviation that we are able to see on the screen. So this is the generic data. So when we try to do a post-test, we saw that for all of the measures, for all of the variables, our research variables, we had a great level of significance. So our t-values are 13, 10, 4, 9, 10, 13, 13, 13, whereas we require very lesser than that. So our mean difference between the pain pre and post, the difference between their depression level pre and post, their anxiety level pre and post, all of this varied highly significantly. This shows that their level of pain, depression, anxiety, and stress have significantly decreased after the intervention. Thereby, our null hypothesis is not accepted. The quality of life has also significantly increased. हम यहाँ देख सकते हैं these 4, pair 5, pair 6, pair 7, pair 8. ये जो 4, these 4 are the quality of life variables. हम ये देख सकते हैं कि उनके mean और standard deviation में भी थोड़ा बहुत improvement है. In this, if you see, the pre and the post means have significantly changed. So we can definitely conclude based on the pre and post test that the intervention has significantly decreased their perception of pain, depression, anxiety, and stress, and has significantly increased their quality of life. Across medical conditions, we try to do a statistical analysis. So across medical conditions, we try to do an ANOVA for understanding whether osteoarthritis or lung cancer or gallbladder disease, between the 3 of these, which medical condition had more effect to our intervention. And we saw for change in pain, we see there is a great difference. For change in the environment, there is a great difference. Other variables were not very significant. So we can understand from this that when compared to other variables across all medical conditions, pain perception, people benefited more. So more than depression, anxiety, or stress, people had great relief of pain, of their perception of pain after the intervention. And within the quality of life domains, most of them felt that their environmental quality of life has improved due to the intervention more than any other domain across all the medical conditions. So now we try to again do an ANOVA to understand whether there is an effect of this intervention on the age range. Whether इस उम्र के जो लोग हैं इस एज रेंज में बेनिफिट ज्यादा होते हैं हिप्नोसिस की वजह से, वैसा हमने कंपैरिजन कर रहे थे. और we see that for depression, people benefited more in all the age groups, whereas for all the other domains, more than all the other domains, for depression, people in all the age groups benefited through the hypnotherapeutic intervention. Same we try to do across gender, and we try to understand that for pain, both the genders felt or benefited more, and for quality of life, both the genders benefited more in general. So these are the graphs that we are able to see who had more significant changes. So in this we can see that male patients had more significant changes in their psychological factors. Lung cancer patients had more significant changes in their pain, and people who are above 60 had more significant changes in their depression. Also, we're able to see that for gallbladder disease, people's quality of life was much higher when compared to both other conditions. So we can definitely, based on this study, conclude that hypnotherapeutic intervention can definitely be used as an adjunct tool in managing pain, their psychological problems like depression, anxiety, and stress, and also to improve a patient's quality of life. So that's with the presentation with message. Would you like to add anything, Doctor?
Yes, Dr. Santhanam, if you want to add something.
Sir, you were on mute, sir.
Thank you very much, sir. Thank you very much. Thank you, Shruthi. Sir, actually, when we are thought about this kind of research, we had very great challenges because this type of clinical population, especially those who are suffering from medical condition, we are not able to see in our clinic. So what we have done, we used to approach the big corporate hospital, of course, through some known sources. We approached very personally, and we approached the head of the department of that particular unit, and we have briefed about and of course we have told about the significance of the hypnotherapy, and we have made them to accept, and actually we try to convince them. Actually, most of the people, they have different opinion about clinical hypnotherapy, and mainly, see, they used to say they are all terminally ill. What you're going to do with this patient? Only we have to manage them very medically. Of course, we have taken a lot of effort and actually made them to get convinced. Then only we have started this, intervention. Of course, really, this is a really challenging research, sir. From our point of view, it is a very challenging research. So this is my humble suggestions to everybody, sir.
Right. Thank you, Dr. Santanam. And
thank you, sir. Thank you, sir.
Thank you, Shruthi ji. It was a very good presentation and a wonderful work you have done. Now the case is open for discussion. If somebody want to comment or compliment or ask something, you are welcome. Nupur, please, you can go ahead. Nupur.
Good evening, everyone.
Good evening.
It was a good presentation, Shruti.
Thank you. Thank you.
And a good research, in fact. And I want to ask, you have given you have given light and something now in the third session.
Body light technique and a control switch technique. Yes.
What is that? Please tell in the detail. Or we can study from any book or.
Yeah, so the scripts are both available in the Hammond Handbook of Hypnotic Suggestions and Metaphors textbook by Hammond. So both these techniques are used in pain suggestion, so pain management suggestion. So, the body light technique goes like the person has to visualize in each part of the body, wherever there is very high pain, they visualize that there is a lot of light coming or emitting from their body, versus where there is very small or minimal, very less light comes in. So slowly we try to use or start with the light, and then we take the patient in during trance. We try to give suggestions like they have a control switch which they can try to turn off light, and as they turn off the light, the pain keeps coming down. पहले जो हमने बॉडी रिलैक्सेशन जो करते हैं, ब्रीदिंग अवेयरनेस जो करते हैं, प्रोग्रेसिव रिलैक्सेशन के बाद उनके शरीर तो बहुत ही साथ हो जाता है, रिलैक्स स्टेट में होते हैं वो, और हमने जो फिनोमिना एनालिसिस करते समय भी उनके हैंड रिजिडिटी वगैरह टेस्ट करते हैं. सो उनके we are very sure that their body is very much relaxed, and from there they are able to observe the pain. The feedback that we receive from the patients is after the relaxation they were able to pinpoint that pain specifically in the areas where they actually felt it. So that was, the feedback that patients gave us were actually more eye-opening for us, because without the relaxation they felt like the pain is everywhere. But after the relaxation, as we start giving them the suggestions in trance, they are able to see that the pain is only in the lower back. For osteoarthritis, they are seeing that the pain is only in the joints here, or the joints in the knee, specifically wherever they have inflammation. For lung cancer patients, I heard a lot of them talking about injected areas alone having very severe pain. For gallbladder, they were able to, after the body awareness or progressive relaxation, they were able to visualize each part of the stomach. So this, after this body relaxation, when we tried to do the control switch and the body light technique, they felt that they had more control over pain. They felt like they were actually able to switch it off, the pain, and they were able to get relief. So for, I don't know about depression, anxiety, stress, the feedback didn't have very immediate effect, but for pain, many of them told they had very immediate effects. So for depression, anxiety, stress और जो quality of life, when we tried to measure, ये जो बोलते हैं these 4 factors हमने सिर्फ रिसर्च में आइडेंटिफाई किए थे कि इसमें इम्प्रूवमेंट है करके, लेकिन पेन every session they did tell that they felt better. So that was that.
Thank you so much.
Very nicely
Very nice.
explained.
Yes.
Good. Anybody else? Avnish, you want to say something?
Yeah,
Please.
yeah. Am I audible?
Yes, sir.
Yes, you are audible.
Yeah. So, Shruthi ji, it was a really Herculean task. Because as Santanam sir said that, approaching hospital, convincing them. My suggestion is always that, in such case, if you find somebody from medical background and hypnosis, take them along with you so that they can convince the medical people little easier and faster. That can be done in the future. You have taken 3 different patients. One is arthritis, which is mostly a somatic pain. The other is a lung which might have spread, the cancer might have spread into various areas, and when the cancer involves the nerves, then you start feeling the pain. The third was gallbladder, whether it was a cholecystitis or there was a stone. These are the clinical conditions, and arthritis has a somatic pain which is driven by different pathways. Cancer, depending on where the spread or infiltration is, whether into the somatic or some kind of visceral components are involved. And the gallbladder pain, I feel more or less is a visceral pain.
Right.
So it will have a referred pain component. So you must be also having people complaining of the pain in the right shoulder.
Definitely, yes.
So this is a referred pain, and that can be controlled very well. So the techniques, though fortunately most of them worked, but I wanted to know the comparison. I think I missed that part. That what was your finding? The arthritic pain was more relieved, or the cancers and the gallbladder, that is the visceral pain, was more relieved?
Yes, sir. We'll go to the slides.
Yeah. So what was your finding?
Yes. So here we have the intervention across medical conditions. We've tried to see. So if we see in this, you see that the mean of score.
Yeah.
For arthritis, we have the mean to be 19. We have the mean to be 9 here, and we have the mean to be around 15 here. So we can possibly say that for arthritis, the pain reduction component, specifically the pain reduction component, is more higher than in the lung cancer and the gallbladder disease. So if we have to rate it in that,
So somatic pain, somatic was relieved more as compared to visceral, because the pathways for the visceral are different, and there is a little more of involvement whenever you are taking the visceral conditions. So that component is also a little more active, and as a result, this is very obvious that somatic pains, they respond a little faster to the hypnosis.
definitely, yes.
So that also you can add in your finding,
And
that compared to the visceral pains, somatic pains, they respond, because you are considering it, what is the variability of the pain perception over the number of sessions, because you have conducted, I think, 6 sessions, no?
yes, so we had 6 sessions. I mean, we didn't have we have not added that as a part of our statistics here for each session. Maybe we can add that. that will, I mean, like how you were saying, sir, that might help.
Yeah,
even
if you have a data, you can add one more thing into that.
we can add that. But here we did a pre and post alone. But like you suggest, I think
Through the sessions, because as the practice increases, the control also increases, and the anxiety component, everything, whichever the apprehension, which also contributes, the psychological component, which contributes to the physical pain,
right,
that can be eliminated, and then the rest of the somatic component can be managed through hypnosis.
definitely we can add that. I'll take your time suggestions, sir. So,
Yeah, so I think that can make it little. Whenever you have this data, you can derive as many things out of it, and then make it a little more rich. So that's a good thing.
Very good suggestion, Avnish. Yeah, appreciate. Anybody else has any question or comment?
Sir, I would like to give a feedback, and it's a real good work done by Shruthi under the supervision of Santanam sir. Because we have seen sir being very structured and systematic and process oriented, and this is what we are looking at our documentation. So, thanks a lot, sir, and thanks a lot, Shruthi.
He can, Santanam sir can. We talked with this about with Prashanta in one of the previous meetings. But I think this research methodology, people who are well versed with it should conduct one short workshop on this for all the group members.
Yes, sir.
That is what I repeatedly, because this kind of combined research between the medical conditions and psychological conditions.
Yes, sir. Yes, sir.
Frankly speaking, we are not well versed with it. Because the limitations of focusing only onto the physical parameters.
Yes, sir. Yes, sir.
In the medical research. So people who are already deep into it can always contribute and teach the rest of the group members. That would be really helpful, and initiate such similar researches. Like we can have multi-centric researches also. When you are picking up something at one place, we can have multiple centers, and we can conduct a multi-centric research also through India, because we have a good network of people available now.
We will do, sir. We will do, sir.
Very good.
Yes, sir.
Very good suggestion, sir. In fact, the population sample size will be the bigger.
Yes.
Yeah.
Can think of a bigger project with more detailed study.
Yeah. Sir, for your kind information, this actually study was selected for our presentation, AoH International Conference presentation.
Great.
Due to some health issues, Shruthi was not able to come. So we have made it as a poster presentation.
Right.
Yes, sir. Yes, sir. After taking the consent from our Palan sir, now she is presenting now.
Okay.
Yes, sir.
So this is an extension of the conference.
Yes, yes. Good.
Yes.
Shruti, आप ये निकाल लो sharing of your PPT. Now I would invite Dr. Rakesh Jain, आपके comments भी, and then Dr. Jain will brief us about the criteria for membership to AoH. Of course, today the number of people participating is very less, but I think Rakesh, shall we explain different kind of membership which we thought of, please?
मेरी आवाज नहीं आ रही? हेलो सर, मेरी आवाज आ रही है कि नहीं सर?
बिल्कुल आ रही है सर।
आ रही है, अभी आ रही है सर।
अब आ रही है, अच्छा ठीक है सर। हाँ जी सर। So regarding presentation, it's a wonderful presentation.
थोड़ा कम आ रहा है पर सर,
हाँ जी,
वॉल्यूम बढ़ाइए आपका या तो फिर माइक का।
अपना ही बढ़ा लेता हूँ माइक को।
अब आ रहा है, अब आ रहा है।
अब ठीक है जी सर। She has done lots of work, very good research, conceptualization wise, implementation wise. I am finding it encouraging, in fact, for other researchers also. So very good. I would like to congratulate Shruthi and Santanam sir for doing such a wonderful work, research work. And I think we need lots of such researches, group researches in our country. It will help the science as well as removal of stigma associated with hypnosis itself. And we can increase applications in medical settings across the country. So thank you very much, Shruthi, for this work. Santanam sir, thank you. So regarding membership, we discussed the type of membership and the eligibility for each membership. Some discussions were held during our general body meeting in Vadodara during the conference. And post-conference, Prasanto has taken a lead and formulated the criteria. I want to share that criteria, eligibility criteria for different kind of membership. So can I share my screen? Yes. Thank you. So I think it should be visible. The screen.
Yes, sir. Yes, sir. It is visible.
These are the types of membership. 6 types of membership. One is honorary member. Next, professional life member and professional annual member. Associate life member, associate annual member, and student member. These are the types, and the eligibility for each type of the eligibility for each kind of membership is for honorary membership. It will be decided exclusively by AoH EC members, and it is primarily meant for senior professionals, those who are working in hypnosis. So the open membership is professional membership. The annual and life membership varies on the basis of submission of membership fee, but the criteria is the same. So it includes professionals from medical field. It can be medical field, medical MBBS, BDS, homeopathy, AoH, and physiotherapy, occupational therapy, allied fields of health, with PG diploma in clinical hypnosis. This is for professional membership. It is an essential requirement, the PG diploma. Then psychologist with master's degree in psychology with PG diploma in clinical hypnosis. And additionally, we are introducing, since there are only a few, relatively few number having PG diploma in clinical hypnosis. So AoH has contemplated on formalizing a 60-hour training program. It may be introduced by AoH or approved by AoH. At this point of time, we are considering launching our own training program of 60 hours, if it is possible, by AoH. So we'll structure a module, the training format, including videos, instructions, books, etc. So in registered or licensed health or mental health professionals, we are using registered word. It can be from any field. So in medical field, mental health may include psychology, and with 10 years of experience and completion of and 60 hours of training in clinical hypnosis. So we want to include in membership the professionals who are already registered with some licensing bodies or statutory body. Because the reason is that they must be having their own code of conduct, approved training program from approved institutions, and supplemented by 60 hours of training in clinical hypnosis. They will also be eligible for professional membership. Similarly, senior postgraduate academicians of psychology, medical and allied health fields, medical social work, human development, those who are dealing with behaviors, mind, and medical conditions with minimum 10 years of experience, and again 60 hours of AoH approved hypnosis training. It will be the same training of 60 hours. So for professional live membership, either PG diploma in clinical hypnosis or professionals, registered professionals or senior professionals having 10 years of experience with 60 hours of AoH approved hypnosis training, they will be eligible for professional life membership. Now coming to the professional life memberships have voting rights. The associate life member will be any person from medical fields, BDS, homeopathy, AoH programs, physiotherapy, occupational therapy, or any allied health professionals. Then masters in psychology, masters in social work, masters in human development, psychology, social work, human development. So the idea of having these persons with the different backgrounds, that they can be eligible to join our PG diploma in clinical hypnosis. So if they want to, they get opportunity and they join, so they can upgrade themselves to professional life membership by completing the above requirement of a diploma or 60 hours training. Then student membership, this will be open for medical and students of medical and allied health fields, psychology, social work, and human development fields. These are the kind of memberships open to professionals, students, persons from various backgrounds. So this is about memberships. Yes, sir.
Thank you. Thank you very much, Dr. Jain.
Yes, sir.
And we will be circulating this send to all the members. And if anybody has any question or doubt, one can ask.
No, it was not question or doubt, but I think I'm just reconfirming it, that the initial post on the professional membership group, which Prashanta had given, I think this was in equivalence with the other international societies of clinical hypnosis. So in future, we are thinking about getting that attachment with them or approved by them.
Yes, yes.
So this was taken. This criteria are matching with that, no?
Exactly.
Yeah, exactly. So
that is the reason why he studied various national bodies like Australian and European and British and various bodies he studied, Prashanto, and then we came to this thing. So good amount of work is put behind this thing.
Yeah.
And,
so after the membership drive, our second step will be to go for the international affiliation.
Yes, definitely.
Okay.
Okay. So here we end up today's meeting. Rakesh, any further comments?
yes, sir.
Okay, so close.
No.
Thank you very much. Thank you all, and good night.
Thank you.
Okay, bye. Thank you.